everyone, I am Dr. Praveen Kumar M, consultant rheumatologist at Daivik Arthritis and Rheumatology Centre, Bangalore. In this video, I will let you know about Chikungunya Arthritis, what is the causes, what are the symptoms, how we diagnose and manage the case. So, Chikungunya Arthritis, simply post-viral arthritis, one of the common arthritis, which is due to the virus, which is a mosquito-borne, like dengue. So it is also spread through the Aedes aegyptus, which is a day-biting mosquito. So the literal meaning of chikungunya is bed in African language. It was first appeared in Tanzania, which is an Eastern African country. The first large cases occurred in India in around 2006. As it is a mosquito-borne disease, the cases usually occurs during the rainy season, starting from July till November. So what are the symptoms? Like how do the patient present to us? It is usually categorized into three stages. There are three groups as such: the acute and subacute and the chronic. Usually in acute, it usually lasts for first 10 days. The patient will have fever. Usually lasts for 2 to 3 days, or sometimes even 1 day as well. Associated with chills or rigor. Along with that, they may also complain or have generalized body ache, joint pain, or rashes, red rashes, usually over the face, nose. And these fever and rashes usually resolves within 3 to 4 days of the time. So, in majority of the cases, the pain usually subsides in around 70% of the cases. But in 30% of the cases, usually the joint pain will persist. That's when they will enter into a subacute stage, which starts from around 10 days to 3 weeks of duration. So in certain subset or a percentage of patient, they may go into the chronic stages. Means they may have joint pain behind 3 weeks, so up to 3 months. So during that period, they may visit a rheumatologist. So most of the patient will have pain and swelling in the small joints of the hands or wrist, elbow, shoulder, knee, ankle, or small joints of the foot. So they may complain the muscle pain or a pain behind the joint line. So usually the fever will be subsided by that time. How do we diagnose chikungunya arthritis? It is through the clinical symptoms, that is what patient says, physical examination, what we see, along with the certain blood test. So blood test will give the information about the inflammatory status and also the confirmation about the post-viral arthritis. So we do a chikungunya arthritis test which will confirm the diagnosis. So what is the treatment of the post-viral arthritis? Usually majority of the patient, the symptom will resolve within a week or so. But in certain subset of the patient, like the patient who are of more than 50 years, if they have comorbidities like diabetes or hypothyroid or chronic kidney diseases. So in certain individuals, so the joint pain persists behind 3 weeks. So that's when the treatment required. Usually we start with a simple painkiller. If that doesn't subside, we go with other drugs. So which will be designed based upon the patient's symptom severity and a laboratory test. So in short, it's usually a treatable condition if the patient visit very early in the disease process to a rheumatologist. So how do we prevent this? Mosquito breeding has to be controlled. So you should empty the stagnant water that is collected in the coconut shell or other. The simple way to control the mosquito breeding is to target the breeding sites. So the empty water which is collected in the outside coconut shell or any empty vessels or any other thing should be cleared, and the larvicides or pesticides should be used to clear the mosquito breeding sites. Apart from that, personal protection is most important. So in the house, you should use the mosquito repellents or a mosquito coils. So and you should wear a full cloth and a sweater to cover the from or protect yourself from the mosquito bite. Thank you for watching. Please like and subscribe for more updates on arthritis and share among your family members and the friends to increase the awareness of arthritis.